Hello everyone, this is Rashmi Mabian-Kaur, Senior Correspondent at ET welcoming you in today's virtual roundtable on patient engagement in the age of connected health. Patient engagement has been described as the blockbuster drug of 21st century. The latest trends such as modernization, hyper-personalized care, and gamification, amongst others, indicate an industry shift to patient engagement across the care continuum. Industry players aspiring to strike the right balance between affordability, accessibility, and health outcomes are looking at connected technology to empower patients and reinforce positive health behaviors for better health outcomes. We will also learn from the industry leaders today how the intersection of design and technology improves patient engagement beyond hospital walls and ensures desired health outcomes. To take forward this crucial discussion on patient engagement, please join me in welcoming our eminent panelists, starting with Dr. Ritu Mittal Garg, Chief Growth and Innovation Officer at Fortis Healthcare.
Hi, thank you. Thank you very much. It's a pleasure to be here.
Mr. Raahul Seshadri, Director of Engineering at Dozee.
Hello, everyone. Good to be here.
Mr. Ajay Sathyanarayana, Practice Head, Digital Health at Tata Elxsi.
Hello, everyone. Thanks, Rashmi, for the introduction and a pleasure being here. Thank you.
Thank you, everyone, for joining us today. We have also been joined by Mr. Narendra, Saini, Chief Digital Officer at Lupin. Very warm welcome, sir.
Thank you, Rashmi.
So before going ahead, I would like to inform everyone that the panel discussion will be followed by a question and answer session. Attendees can share their questions in the chat window and our experts will take them up towards the end. Now, without any further ado, let's begin the discussion to really understand how patient engagement is shaping the future of healthcare today. So my first question to Ms. Ritu is, what are the typical KPIs to monitor patient engagement and what is the health IT executives investing in to move the needle on patient engagement scores?
So for us, as many other industries, the Net Promoter Score remains one of the key indicators for patient engagement as well as patient experience. Over time, of course, we are evolving the way we calculate or we capture the Net Promoter Score, and it's no longer about taking the feedback forms and manual, but how do we digitize and automate it? And it still remains one of the key indicators. Beyond that, repeat OPD footfalls, I think, is an excellent indicator for us to know how patients perceive us when they visit us and how well have we engaged them over time. The third that is an upcoming indicator is the mobile app. So we recently, not recently actually, 2 years back launched a mobile app, and we've been working constantly on it to provide an ecosystem to the patients for all their needs and having a seamless experience. So the mobile app retention and how much usage each one of them has for their appointment and other needs is also an excellent indicator for us, which is reflective of both the kind of experience we are able to offer them offline and online, and remains a significant KPI. In a healthcare setting, there is a whole clinician component, there's a whole medical clinician component, and then there is a technology component. So here we work very closely in a multi-stakeholder environment. And between the IT teams, the medical teams, and the business side is where the convergence happens. And some of these indicators are discussed, which would have the strong infrastructural and IT support, as well as good patient-facing KPIs like footfalls and NPS and so on at the same time. So that's what we are all working towards.
Thank you, Mr. Ritu. Mr. Narendra, what would you like to add to that?
So I think what Ritu mentioned is pretty much industry standard, and I think almost everyone is looking in the similar direction. So particularly when it comes to the patient experience, we have to really look at. Generally, they are always looking at their information, whether that information is really secure or not. I think this is one factor which is called trust in the services, right? So the trust factor will become very, very important, because some of these information are pretty much close to their heart. They don't really want to share with anyone, absolutely anyone, right? So I think those are also some impediments as of today for the adoption. But I think over a period of time, we should be able to resolve that particular aspect. Over and above what Ritu also mentioned is we are also looking at the patient do not really, they really test out the way they are talking about services. The same is with the doctor, right? So if they go to 1 or 2 or 3 doctors before they really get into something which is a serious engagement with an ailment. So the availability of records across different doctors, which is uniform records across different doctors, is also very, very important. That means we need to be able to provide an interoperability or interoperable platform where the EMRs are available uniformly across the platform, but at the same time in a much more secure way, which the patient can control. So there are certain aspects of this part which probably we are also looking at it. I believe this is a very important aspect in the next couple of years, in which will decide whether a particular service is successful or not. So the additional aspect that we are looking.
Mr. Ajay, your views?
Absolutely. I definitely agree to comments from Dr. Ritu and Mr. Narendra. So to summarize, I think the key KPIs would be, one is increased patient enrollments for care. I think we are striving to make sure that there is more coverage, especially in countries like India, where community health takes precedence. So increased enrollment, and the second would be the continuity, care continuity. So there is no discontinuity. Care continuum, as Narendra was referring. So these two, along with effective utilization by bringing care optimization, effective utilization of health services by bringing in care optimization. We all understand that there is this imbalance between the care provider versus the patients worldwide. So the technology adoptions are primarily focused to bring in optimizations of effective utilization of resources. Resources could be those physical resources, med devices, med solutions. It also implies to the shortage of doctors we have, and how technology can bring in those improvements, effectively utilize doctors' time in having increased availability for the patient care.
Mr. Raahul, would you like to add anything to that?
Yeah, so this is more from a company that creates these medical devices, right? So there are two aspects to us. Dozee is a contactless remote patient monitoring, suite, which has a hardware and the software component. But primarily, there are two major verticals that we divide it into. One is home, and one is hospitals. So when it comes to home, of course, the key KPI here is how often the device is used once it is purchased, right? Ideally, it should be used every day. And even the product is designed in a manner that a person does not have to actually go out of his way to use it every day, because it is just set up once. But that is a very strong indicator for us. And everything else becomes like, a qualitative effort toward, attaining this metric. On the hospital side, as Mr. Ajay also mentioned, that there's a huge shortage of doctors, and during COVID times, this was abundantly clear. And that's where connected health kind of comes in, and that's where Dozee kind of became a device that could turn any hospital bed into a step-down ICU, right, instantly. And there are key KPIs: how many beds have Dozee on them. So that's where our campaign, Har Bed Dozee Bed, kind of comes from, because the more amount of beds are, have Dozee, for example, for us, the more connected that data is. Because if you don't have any tracking tool on any of the beds there, so that data is not coming in and it's not being used to then improve the life of the patient. Right. So for us, the number of installation there and successful usage of the product is like the very high level KPI.
So going on to the next question, what factors drive patient engagement in a hybrid care setting? You could take that first, Mr. Narendra.
I think hybrid care, we just started off, on this particular segment. There are things where a patient over a period of time, they are particularly critical to once they probably get operated and things like that. They would want to go back to their home kind of a setting, and then continue the care over there as well. So continuity care, Ajay mentioned. So it's not only across the doctors, it's also across the locations and places that the patient is, right? So and in those in that particular scenario as well, the patient would like to see how some of the vitals are being monitored, and that information is available to the doctor. And that's one part. Second part is also the early warning in case of any issues happen, right? So while Raahul mentioned about the devices, can we really look at these devices which are giving, one is the vital information, second whether they can be trusted. That means as an equipment is a medical grade equipment. But having said that, the cost also is another very, very important part, right? So when we go from hospital care to a hybrid care kind of an environment, all these factors will become important. So I think one unit from Lupin is particularly addressing this particular segment. However, I think when it comes to the adoption of this particular hybrid care of scenario, I think it is still a long way. We have seen some successful with the elderly care in India and also in abroad segment. So there are elderly care, elderly homes which are available now. They're like those things are also there. But I believe the adoption, particularly Indian scenario, is a way to go. I think still a few years before we are there. But adoption is there. I can definitely say that some adoption is there. And these days, people are really, they've started using their Apple Watch, Samsung watches and all. I think there was a case when a person started seeing the lower heartbeat over a period of time, and then they all of a sudden their Apple watch reported that, and they went to the hospital and then figured out what could be the potential scenario. So this is about early warning system that I just mentioned, right? So these devices provided an early warning to the patient without really telling what exactly the problem could be. Now they went to the doctor. They figured out that there are some serious blockages which are there, and the patient needed to be operated around that time without really experiencing any heart attack or major issues. So these kind of things that we probably need to look at from hybrid care. So we are only looking at post hospital care, but also I think we need to also look at before we get into those kind of scenarios or these kind of situations arise, can we get an early warning over there? So multiple aspects, multiple dimensions. I believe Ajay and Ritu will be able to add a little bit more on this.
Thank you, Mr. Narendra. Ms. Ritu, I think you would like to kind of add on the early warning part of it.
Yeah, sure. So even before we come to the early warning, I think, in the hybrid care setting, models that are evolving, the most important thing is the seamless omni-channel experience. I think that's what the patients are looking for. So when they log on before coming to the hospital and they go onto their website and they start experiencing the brand, from there, the expectation sets in. Now, if you've got that a seamless appointment experience, they get what they're wanting, they don't want to spend too much time. It should be easy to navigate, and that's where the expectation setting happens. And if you've got that piece right, once they walk into the hospital, the expectation is to have exactly the same experience till they are out of the hospital, and that's not as easy, right? I mean, that's again, you've got clinicians, you've got nurses, you've got paramedics, billing desk, and all of it. But the expectation and the challenge for all the healthcare providers is to ensure that in today's world where people are used to getting instant 10-minute deliveries at home at a click of a button, all prepaid, how do you gear up your system to be able to deliver on those expectations? And that is what we are working towards very aggressively through multiple projects that are going on in the Fortis right now, as to how to ensure that the kind of experience that they're used to outside the hospital is something that we can replicate when they're in the hospital and once they go home. That would include ease, convenience, and all of those things. The second very important, which is again specific to the healthcare industry, would be very personalized communication, but at the same time, to what Narendra had pointed out, not at the cost of privacy. So they don't want random people calling them that, you've got diabetes, you want to get this checked. It is unnerving. I that's not something that I want to flaunt and talk about. So how do you remain, how do you ensure that, you still develop the test, make sure that the data is protected, and still reach out to the patient when they need you? And I think that is a very, very important component of this whole hybrid setting. So when a patient goes home, we don't want to be intrusive and say that, this is what you need to do. But at the same time, we need to be there in the background when they need us, when one of their parameters is going off, and we know that this is an important parameter that needs to be monitored and it needs attention. That's when you want to show up and face. So you want to be there at the end, supporting them through and through, and not be intrusive, and yet, deliver the seamless experience.
So my next question is on the similar lines, and I would like Mr. Raahul to take it. So how is the healthcare industry really trying to address this critical areas such as data management, cybersecurity, and the safety of patient information to earn this patient's trust?
So, India underwent this whole digitization bit, but it was in the finance industry that we, saw the maximum, digital adoption. And in healthcare, there's still a lot of things which are done, but not specifically. Right? This is going to now become an issue starting today, and we're all going to debate on it. But till that time, there are already standards for data protection. Like you have, for example, in Europe, you have GDPR, but there is a corresponding ISO 27701 privacy controls. For information security, you again have a bunch of ISO controls, and you have quality management controls in place. And these are very standard, and they are all, everyone in this business of healthcare is already aware of what those controls are and what is needed. So whenever you're working with a vendor or anyone else in, with sensitive data coming in, you ensure that these standards are followed. And a lot of this is, baseline of what any company, any cloud company that's holding any kind of critical data would have to do anyway, right? So that is the initial step, but it still requires a lot of formalization because the general public is still not aware of where the data is being stored, what is happening to it, and what precautions we are taking in language that they can understand. So that is still like an education cycle that has to happen in the coming years on it. But most of them are currently being solved using industry standard protocols there for data protection and additional precautions that that hospitals themselves have developed over the years and insist that everyone follow. Right. So that's where we stand today.
Mr. Ajay, your views on this?
Sure. Yes, I agree to what Raahul shared. Tata Elxsi being working in technology enablement for future products. The observation what we have is the data is always increasing, and the current number of connected devices are always increasing, and they will keep increasing. Now, the vulnerability what we have in the space will also keep changing. It is you don't have a solution which works today and it will not work tomorrow, right? That's the situation we are in. So how we cater to it is the vulnerability checks and cybersecurity protections are applied at multiple levels and multiple parts of the solution. There are medical devices which are now modernized to take care of certain vulnerabilities at that level. There are network-specific vulnerability checks which have been brought in. And of course, there are these cloud adoption and cloud-specific vulnerability checks which are coming in. There is a pattern which we have seen that most of these threats and vulnerabilities are happening at the application level. With more and more software adoption happening in this space, more and more application coming in this space, more and more workflow enablement at the software happening in this space, and regulations are trying to bring in or have better coverage, but still there is certainly a gap. Now, one of the initiatives we have taken to cater to such changing environment is to make it more intelligent. Today, the AI, ML, and the data mining solutions are made more intelligent and more relevant and brought in together along with cybersecurity. The algorithms which can self-learn and recognize some patterns and bringing in more self-learning improvements to cater to some level of vulnerability. But the fact, right, which we all have to agree is, if you see the metrics today, only about 70% of the cybersecurity threats and vulnerabilities are known, identified, known, and acknowledged. The 30% are unknown. They are maybe at the preliminary early stages, and then only when they cause trouble to an existing workflow or functionality, that's when we realize. And that's a gap which industry is still working to solve. But then there are progress made in this direction.
Ms. Ritu, what are your views on this?
Yeah, so extremely important. See, we are a healthcare provider. We have millions of patients who come to us as entrusted us, and it is our absolute accountability and responsibility to ensure that the data is protected. And so we have a formal data protection officer, whose only job is to look at data protection policies and implementation at various levels. So we have started with multiple policy levels as well as different projects to ensure, the security at every level. We also work a lot on the infrastructure security and owning the data centers, and ensuring that we have the full control of data either through our own servers or our own cloud. And I think that is the change that has happened over the last couple of years, and we're strengthening that, so that there is a minimal room for manipulation or data leakage, and data is always and 100% stored in a safe environment with the controls that are available to only a handful of people. There is also a data protection, leakage protection tools that are available. So in all, I think, as a large healthcare provider, we totally understand the responsibility on it, and are working in every possible way to ensure that patients' data is fully protected at all times.
Agreed. So the next question is around the role of design thinking and how it really addresses the challenge of non-adherence. Mr. Narendra, how would you want to address this question?
In fact, you kind of nailed it. So design thinking is something we all have to really go through. I believe while we are here as participant, we probably do that within our team. See, this as a product, we are looking at most of elderly people, middle age probably not that much, but then the Generation X is also becoming very, very sensitive to this kind of information, right? They are using all the gadgets, all the devices, and they are open to use without any problem. They are also okay to share their information. At the same time, I think the elderly people, they are okay to share this information because it is critical for their care. Right. Probably the generation in between may take some time in the adoption. So we really have to see how we can make the product, which is on one side is simple to use for the elderly population, because their literacy level or their understanding of the UI probably is very basic, and we need to be really able to convey the information in the best possible way to them, and highlight it to them without really bombarding a lot of alerts, SMSs, and whatever, right? So extremely important. On the other hand, we also need to look at providing right kind of analytics, right? So currently, I think the amount of data that we have, even if we are saying that we have terabytes of data or maybe tons of data available, but data may not be sufficient to do the modeling of certain medical condition over a period of time. I think we'll still take time to mature to that level, and it's across the industry. I think nowhere in the world people are able to say that if you have this kind of trend, then you definitely have this as an ailment. They are just indicative. I think it will take time, but I think our Gen X is ready to take up that challenge and probably go through and understand those things. So while at the same time we have to look at both experiences, their extreme experiences, in fact, extreme end. So this is where the target segment and understanding how do we build a product which is simple to use, but still as accurate as possible, and at the same time as trustworthy as possible, right? Mm-hmm. So there are a lot of from the design thinking point of view, I think a lot of challenges within ourselves. I can tell you in last 1 year we would have had maybe multiple, maybe 10 plus exercise that we have done, maybe more than that. So I believe it is extremely critical here at this stage, and it is across the board. I believe everyone is doing that brainstorming internally. I believe the other panelists will have a lot of to add. When it is one thing on the application side, is also important from the device side. Right? I think Raahul can add more, but the applicability, how you use the device, it is simple to use, but it is also at the same time reliable. Your sensor nodes, even for ECG, can you do with 2-lead ECG, or you need 6-lead ECG? How you can actually make sure the data is more reliable? So multiple aspects are there, and I think everybody is doing that. Extremely important part. And Rashmi, thank you for this question.
Thank you, Mr. Narendra. Mr. Raahul, of course, I'll be coming to you on how Dozee is really using design to address the challenge of non-adherence?
So one of the biggest problems with any device is, if it's too cumbersome to use, at least in a home setting. For example, in hospital, again, you can enforce some of those things, but in home, it really does not happen if it is too cumbersome, right? Even a wristwatch, if you have a smartwatch, you have to now charge it every time. And if it's not charged, you may not put it on. So a lot of these problems kind of come in. With our contactless sensor, one of the challenges was our sensor does not go on top of the bed. It goes below the mattress. So we have to still get signals from 6 inches to 12 inches of mattress that you would have, still decipher it, and then determine your heart rate, your breathing rate from a data which is muffled, right? Because it's below. But what this does is, since it is below the mattress, originally this was for COVID, right? Because you did not want things touching you. We wanted things to be as contactless as possible. But today, that problem, having solved that problem, it does this new, this new innovation here that since it is underneath your mattress, it does not disturb your normal flow. So, above the bed. So it does not happen that when you just, replacing your pillows or anything, that sensor just gets dropped somewhere. So it is always underneath the bed. The device is always on. It detects whether someone is on the bed or not. So you don't have to wake up and say that I'm no longer lying on the bed now. So you have to stop recording. You just wake up and it stops recording. And when you lie down on it, it starts recording immediately. So this seamlessness required a lot of thinking. And even when we know the solution, the real challenge is how to engineer it, because we usually have a good clarity on what solutions would be used by people and what would be convenient. But engineering it is a very different challenge, and at the same time making it robust, making sure that you're not sacrificing quality for convenience. So that's where design thinking primarily helps us, right? Keeping it as simple as possible for the end customer there.
Thank you. Mr. Ajay, do you agree with that, or you feel there is something that we can still look at?
Absolutely, I completely agree, and thanks for sharing that product example, Raahul. See, the landscape has been changing. The expectations from the end users have been changing. I mean, as they say, right, companies today are not creating product; they are creating experiences. So those which have really worked with the empathy of the end user are those which are lasting there in the market, and this actually puts a lot of importance to the way the products are created, and the design thinking is something which is not optional anymore. I mean, we really have to understand the end user perspective and then create products here. Now, while we say that, it has actually enabled lot of scope for creative designs, creativity in the space, and of course, there's a lot of innovation happening, and there's iterative upgrades and product modernization which is happening to make it more and more easier and simpler for the end users. Now, patient centricity is the bottom line here, right? I mean, what the products which are made patient centric or the user centric are those which last long. So completely agree with the panelists here. The design thinking is no longer an option, and Tata Elxsi has been adopted design thinking as a standard here. I mean, each and every product here undergoes an extensive design process. 80% of our work goes in designing, and then 20% is actually creating the product. So a lot of empathy based research, user research has been a practice here, and I'm sure this is just this reflection of how the industry is working in creating new products.
Thank you, Mr. Ajay. Ms. Ritu, what do you have to say? What have you seen when we talk about design thinking in hospitals, especially?
So again, very critical, extremely critical, that defines the design and the creativity at the time of concept, kind of decides the success of any product, literally. My experience is that multi-stakeholder engagement, again, at the time of design is extremely important. And while, to add to the point that, you need to think about every single thing that a patient would feel in designing even a workflow area or a product product or anything, it is equally important to also think about a paramedic or a doctor who's going to respond to that situation. And many times what happens is when we design something, we design it for one stakeholder, primary stakeholder, of course, let's say a patient, but let's say you developed an app, right, for a doctor appointment. So the user interface and the workflow is extremely important from the patient point of view, but it is also equally important from the doctor screen point of view, and whether it takes care of the issues that a doctor is likely to face. If the doctor is in between the consults, and is there a good mechanism to get him or her an alert? Typically, they're a little busy. They do not have very set schedules. It's a little unpredictable. So when we design an application for patient to connect to a doctor, so keeping the patient in center is extremely important, but so is the doctor, so is the other side. So to Rahul's point, let's say for a product like a Dozee, and we are working with Dozee at one of our hospitals as well, and it's been a great experience, but also equally important is that who's going to see that alert? So all these remote monitoring devices are monitoring a patient to send out an alert. And many times the patient is not fully equipped to understand the criticality of the alert. So that means there has to be a provider at some end in some form to be able to, understand whether this alert is critical enough to act. And that ecosystem is equally important. So when you do a design, it's very important to see who's going to alert, where is that, is that nurse going to be on the nurse station? I'm talking about within the hospital setting at the moment. But, how much time is it going to take for that nurse to, come? Or are we saying that there's going to be a command center, which is somewhere a little out, and the alert is going to go there, in which case, how much is going to be the response time? What we don't want is that have the ability to monitor and have timely alerts, but not being able to act on them as swiftly as is needed. So when we do a product design and a workflow design, it is extremely important to be able to also identify what is the response that is expected out of that alert, and keep that in mind while designing the workflow and the product.
So while we've discussed a lot about the design thinking and technology, now I really want to come at overcoming the challenges. Really, what are the technology and application trends that you feel are really shaping the healthcare industry today? Starting with you, Mr. Ajay.
Sure. Thanks for the question. I mean, certainly the industry is evolving. The changes are evident. The needs are changing. If I have to list down the top trends, what we observe as a technology enabler. So first is there is extensive hyper personalization. It is kind of a matured next level of personalization, which is beyond gender-based or age-based care providing. It is more about I want my healthcare solution to be just made for me. And that's the expectation. I think the industry is striving towards it, and to make it just how they want it, how they the workflow, their journey for their product, for their solution has to be defined, and to keep it extremely flexible. So a lot of research and work is happening. The next critical item is the engagement factor. We spoke about patient engagement. Now, there are certain technologies which are kind of enabling. There are extensive solutions which are coming up, which take care of socializing a patient group, right? I mean, there is this multimedia socializing group, or a Facebook for a group of patients who can discuss, share media, and then have conversations. And this group for doctors which are created. Somewhere, there is that care assurance which is provided, and there is this level of socializing which are being enabled in this domain. Now, further, we are also seeing a trend in adoption of technologies like gamification getting into healthcare. So, I mean, we are all used to Apple Watch, and we also quoted that example, one of the panelists earlier. It's not just about counting the steps and the calories we burn in a day and the cups of water we drink. It's getting even more advanced, where there is bidirectional kind of involvement, like you walk 1,000 steps for 1 week, and here is a reward card for you to buy your running shoes, so something like that. So where there is encouragement coming in, there is reward happening, and then there is also a way to also keep up with the health improvement trend of what the patient has undergone. The next level aspect of this is adoption of technologies of video analytics image analytics in care providing, and we have seen faster adoption in diagnosis such as mental health, behavioral health. Like digital therapeutics is an area which has been constantly being researched, and the digital technologies where the patient's mental health progress or behavioral health progress can be quickly tracked. There are video analytics which can be applied during a live telemedicine session between a doctor and patient, and it actually not just is providing an alternate to an in-person care, but it is actually becoming the norm. I think the digital technology today can do better than the in-person care. I mean, we spoke about hybrid care earlier. So where we see that these technology adoptions and then enriching the care providing, the ease for care providing will certainly move some aspects of diagnosis permanently to a virtual care, because that works better both for the provider and for the patient. So while we see all this, I think again we have trends observed region-wise. Tata Elxsi works for our global customers. The trends vary from region to region. The North America being more patient-centric, payers-centric geography, payer-centric market. There is extensive care optimization which is being looked up, and Europe basically being more of regulatory compliant. There are these adhering to regulatory challenges, regional specific, country specific challenges which we are seeing and changing. Like we saw about the recent changes in the regulatory compliances which has come in. So that is a trend. APAC has been we see APAC again. Each country has different trends here, and country like India, where we see a revolution happening in digital care. I mean, we are seeing extremely high involvement from the government to bring in improvements. There is stress on community care, community health care optimization, getting better solutions, affordable care. So some of those are the trends what we have seen globally.
Thank you. Mr. Narendra, your views?
So I think technology-wise, we really look at, Ajay has responded to it anyway, and as far as the front end and back end is concerned, right? The front end part, I think we talk about omni-channel, we talk about hyper-personalization, right? We talk about the way that we are interacting with different stakeholders, be it on the patient side, the caregiver sides, the doctors, and also the different stakeholders for that matter. I think the backend is also extremely important. Right? I believe we looked at 2-3 aspects initially. We looked at the trust factor. That means the system or the backend should be able to manage the data privacy well. Okay? That means there are different zones in the backend that we are managing. The interoperability, I think we also talked about it. That also is a platform choice. That means how and which ways we actually are working with the interoperable platform in the backend. So a lot of standardization of the records that happens, and that's an activity which is, be it a device manufacturer or the service owner or the backend system. So all those things need to really look at the standardization of protocols, the way that they are communicating, the way they are managing the data and other things. So those things are important. So while these are more generics, I think specifics are something which are left to the organization, the way that they want to design the back end and the front end, right? And that's where the uniqueness of every product comes in. So I think technology spread. I don't really see a big challenge there. I think technology is always available once we are able to understand what are the customer needs, right? And we map a technology to that particular requirement. What is important now, what is evolving, is the use of advanced analytics part, right? So when we talk about the platforms, we talk about maybe multi-layered architecture in which we are able to share the information the way that how we want to use it. But I think the advanced analytics also becoming more and more important. I believe while we are doing some sort of edge analytics, the device telling you about the ECG record and whether the giving you a potential prediction of some anomalies. So that is being done at the device itself. That means there is an edge analytics which is also important. At the same time, the long-term records on the history records on which is available on the platform. So those kind of trend analysis and then raising the right kind of an alert mechanism to different stakeholders is also equally important. So I believe a gamut of technologies. It's how to achieve advanced analytics. It could be multiple technologies. How to achieve the transactional integrity of, be it a payment transaction or be it the information transaction that happens in the between the front end and the back end. So I think those things are equally important when we design such an interface and such an application. So all those things, with definitely with the choice of technologies that is unique to every design. So would not comment much on that, but as far as the spread is concerned, this is by and large the spread is. I'm just leaving out the embedded system part, which is definitely, I think Raahul and Ritu can also talk about more. But that's another part, the extremely critical part, which is coming about the edge side. Back to you, Rashmi.
Thank you, Mr. Narendra. Mr. Raahul, your views?
It's going to be a combination of all that I've heard, so it may not be all new. But the first part is, I think, as Ajay also mentioned, Apple Watch every wearable used to be an activity tracker before, right? So now we evolved it to, it has started now looking like, not exactly, but toward clinical parameters. They may not be as accurate as healthcare providers would want. But now we are going toward an era where connected health is now possible because, you have consumers already using something from this side. And it's only a matter of time that such wearables can, start becoming clinically prescribed for certain people, right? Not just for, not just when you are seriously ill, but also for preventive healthcare, right? Of course, the reason why connected health there matters is early warning. That again we talked about before, right? So you don't have to wait for things to get very worse and noticeable before we do something about it, and that allows you to get better in your own environment, right, without having to be in the hospital for extended period of time. The second part again was mentioned was interop. So early on, without interoperability, what used to happen was if I have to make a medical innovation, then I have to own the whole stack, from the hardware to the firmware to the cloud to whatever analytics, algorithms that I might have. Today, there are companies dedicated to, analyzing your data pretty well, but they don't own any of the sensing stack. So the biggest problem here is that of privacy, right? That's going to come up very soon now that interop is going up. But it also allows every company or different players to do what they do best, but in a connected fashion themselves provide a healthcare package to the end customer, right? So you don't need to be a person who creates the best firmware or best hardware device, and at the same time the best algorithms for figuring out whether you have arrhythmia by looking at your ECG data, right? So this can be now divided because of interop, and that's the amongst all the trends that is happening, this I think is the most important, because it's not just connected healthcare on the front customer side, but also on the back side, where people, companies who have not met each other before can still collaborate and create something very useful. So yeah, that's my 2 cents.
Thank you, Mr. Raahul. Ms. Ritu, would you like to add something to that?
I think more or less it has been covered. I would just add a little bit more specific from the healthcare provider side. Ultimately, all our aim is to provide good quality healthcare to as many people as possible at affordable, right? And there's a lot that is happening in every single, I would say, aspect of that. The biggest challenge that everyone is facing, and many of us are actually facing, is very structured EMR at the moment. And I think that remains one of the top priorities for many healthcare providers, including us. And, we are already on that journey. And that's when the excitement would begin, right? I mean, so, the applications on the AI, whether it is on the radiology, on the number of, correlating it with the doctor notes, and creating the whole paradigm would be exponentially more useful once we have this whole baseline structure of EMR, which would get adopted and that's like 2 years from now. And that's when we would be looking at all the applications across the patient journey to really add to the whole experience. We are all working on the similar things, the CRM, ensuring deploying the patient engagement tools, as well as within the healthcare, how do we, be on the edge, on the cutting edge technology. So all the medical equipment today is equipped with very sophisticated softwares, and that ties into the entire patient journey within the hospital as well as outside. And these are all the dots which are getting connected off on. And then in 2 years, all these applications are likely to come together to form a very seamless ecosystem.
Thank you, Ms. Ritu. So before we close, I would like you to share one message to the audience on what could be the next step, that overcoming the challenges, of course, what should be the next step or next focus to really make patient engagement more fruitful going forward. So starting with you, Mr. Ajay.
Yeah, I think the extensive adoption of patient-centric solutions and creating solutions which are patient centricity is the future. Primarily, the healthcare industry is moving towards more of patient engagement and patient retention. Digital technologies adoption has been on a good trend path, and they will continue to increase in adoption. The regulations will continue to evolve. They will make it more easier for deployment or adoption of technologies to improve the healthcare care providing. As Mr. Narendra was saying, there are technologies already there. I mean, they are cross-domain, cross-industry technologies are now coming together, which is now catering to the healthcare industry and the needs here. The challenges which are solved in other industry, like data management, security management, are all something which we have seen in the other industry and other world. But the adoption of that, the ensuring how it is relevant here and the solutions are relevant here and how to adopt it here, are those which I think the things which we could see coming up in the future.
Thank you, Mr. Narendra. Your message to the audience.
I think Ajay covered it all. I think we have been talking about these things for some time, but I think over and above, if we really look at the softer side of it, I think trust becomes extremely important content, right? Be it the backend stability, be it the front end, be it the devices, be it the interoperability, or be it whatever it is, right? The trust factor, okay, how reliable is the service? How reliable is the indicator or alerts? How reliable is the doctors or maybe the reliability of the services, different components of services becomes extremely important, right? So I believe one of the major factor in next 2 to 3 years time that will decide which service will continue and which service probably will not. Largely, it will be on the trust factor of the service. We need to really look at how different components of the technology stack will contribute to build the trust. I think that's the time will tell. I don't have any straight away answer for this one. But I think the time will tell about all these things. So I think Ajay, Ritu, and Raahul anyway covered major aspects of the technology part that we talked about.
Mr. Raahul, Ms. Raahul, would you like to highlight something through your message?
No, I think I would also go with trust because that's the biggest factor. But it's trust somehow made convenient today, right? So with patient engagement, with the whole mobile revolution, there's not a lot of technological challenges that are remaining to be conquered, right? Because as long as we're collecting data, we are digitizing them to whatever extent,
right?
Then making them, summarizing them and making them available today digitally to every person is very simple because we have mobile phones now. 12, 13 years back, where you expected everyone to have a desktop or a laptop, right? An era that is long forgotten, although it's very recent, was very impractical, right? You needed to have hard copies, and it was very difficult to do that. But today, with the app ecosystem, with everyone having a mobile phone, it's technologically very easy. But then trust becomes a very big factor because, the moment you share data, it's now going to be seen by, the patient, and then a lot more people, and a lot more people will rely on it. It's not just that, you're the only person relying on it, or the healthcare provider is the only person relying on it. A lot more people relying on it. And if you add interop to it, it means that, data would, at the discretion of the patient, would go to a lot of places from which a lot of conclusions will now be drawn. So trust which means, the whatever we create has to deliver on what it promises, right? And if it cannot, it just says that, yeah, I mean, I don't have an answer to this, especially with computer systems nowadays, because AI is very notorious for sometimes not knowing that it does not know the answer and would still give you something else, with very high confidence. And this is, throughout the industry. It's not just a healthcare problem. This happens everywhere. But with healthcare, it's a bigger problem because, just giving out wrong data is going to have, a lot of consequences that may not be there, and maybe your spam filter, right? So that's where trust, I think, is the primary kind of thing, because everything else relies on it. Or else we can't build a digital ecosystem on top of it.
Thank you, Mr. Raahul. Ms. Ritu.
So my message will only be to continue doing what we set out to do. I think for all of us, and have quick learnings and evolve and pivot if we have to over time. But I'm sure the healthcare is a very exciting place to be. There is so much happening there, and there's definite need out there. And the way the building blocks are coming together, it is definitely very exciting. And so we just have to continue doing what you're set out to do. Just keep learning and be at it.
Thank you so much. Thank you, all the speakers. And well, this brings us to the end of this very interesting roundtable. And I would like to thank all the experts for joining us. And I really appreciate the views that we shared, the interesting and insightful discussion that we've had today. Also, a very big thank you to all the attendees for tuning in. Lastly, but not the least, thank you and have a great day.